Now, understanding the insulin, the regulation and structure, it's important that you can see, how everybody knows that the insulin is two peptide chains secreted by beta cells of pancreas in response to the glucose in the blood. So glucose is a kind of a sensing thing for the, so pancreas is secretes insulin when it senses glucose. So glucose is like a sensor. So glucose is important for the insulin to come out. Insulin is made up of two chains. We all know alpha and beta chains. Alpha has around 21 amino acids, beta being 32 amino acids. The last three amino acids are very, very important because these amino acids at the beta chain can be changed to form from the human insulin to analog insulin. These are three important amino acids called threonine, leucine, and proline. Remember those three amino acids which are going to get changed and analog insulins are going to be formed. Just to change the, what we say, the prolongity of the insulin, or how do you want the insulin to be absorbed. If you want to change the properties, the pharmacokinetic properties, the pharmacodynamic properties, just change the amino acids here. How insulin is regulated? Very important that glucose in the blood has a major role in insulin secretion. So it has a major control. So beta cells of pancreas are stimulated because of the glucose in the blood. Also, there are other GI hormones like incretin hormones, which are coming from the small intestine, which are going to stimulate the beta cells. Amino acids, proteins also, remember, they will also incite insulin secretion, not to the extent of glucose, but yes, they will increase the insulin secretions. Remember this. And then you have a food intake, which is going to regulate the GI hormones, and also parasympathetic system. So parasympathetic system is important because it regulates the insulin secretion. Sympathetic stimulation will inhibit the insulin secretion. So parasympathetic and sympathetic will go in the opposite direction. So parasympathetic system has to be intact, GI hormones have to be intact, glucose is a major control, amino acids also inside insulin secretion. This is how the insulin is regulated. The secretion of the insulin is from the, you can see the beta cell. This is a prototype beta cells. When the glucose is sensed by the cell, it is going to this receptor called GLUT2 receptors, goes inside. From this glucose, the ATP, the energy is produced. This energy is going to move this channel, which is called ATP potassium channel. This potassium is going to go out of the system, which is going to depolarize the cell here, and because of this, the calcium is going to come inside, and this, the insulin in the granules is going to get secreted. So this is how the insulin is released. So glucose is a sensor. If the glucose sensing is stopped by the cell, the pancreatic cells or beta cells cannot release insulin. That is very, very important to understand. So glucose has to be sensed by a pancreatic cell. Physiology of insulin secretion, very simple. The insulin is released in the form of pulses. So it will keep releasing intermittently, and this is called basal insulin. This is called basal insulin. So we all are releasing the basal insulin, right? The insulin which is regulated slowly, which is released throughout the day in the form of in the pulses. That is called between the meals also and the night, and that is very important to keep up the insulin secretion on the higher side. Otherwise, we'll all, what will happen, there will be a lot of glucose which is going to come from the liver. The hepatic glucose output is going to increase. To suppress that hepatic glucose output, we always have some basal insulin in our system. And whenever you eat a meal, you have a bolus insulin. That is a bolus, a meal insulin, which is going to be sent. The food is going to be sensed by the pancreas, and you have going to spike of insulin coming up as per the spike of the food. So as the glucose goes up, the insulin is released, and as the glucose goes down, it goes down. So it is a glucose dependent. The insulin release glucose dependent physiologically. Everything is glucose dependent. Nothing goes independent. If this becomes glucose independent, you will get hypoglycemia. So it has to be glucose dependent insulin release. Now, how the insulin is metabolized after the release? The insulin goes in the circulation. It goes primarily is excreted to the liver for the endogenous insulin. Whatever endogenous insulin is released from the pancreas is metabolized by the liver. Otherwise, whatever insulin you inject in the patient, it is excreted through the renal. So this is a major metabolizer as far as the injected insulin is concerned. So kidneys are very important. If your kidneys are not working, whatever insulin you are injecting is going to get stacked, and you're going to get hypoglycemia. So remember these things. Degradation in the cell will happen. Some amount of insulin is degraded inside the cell. There's endocytosis of insulin receptor complex, and degrading enzyme is present. So there's endocytosis, and the insulin is degraded inside the cell. What are the indications of insulin therapy? When you want to give insulin to the patients. But of course, we have patients who have type 2 diabetes, which are not controlled with 2 or more than 2 oral agents. ensuring adequate dosage, that you are given adequate dosages of those two drugs, and still the drug combination of two classes of drugs are not able to control your blood sugar, you may think about insulin therapy. Or if you have already given 3 oral agents, then you must think about uh, insulin therapy. Type 2 diabetes during periods of physiological stress like surgery and infection. Of course, all these patients who are going to go through pregnancy, do surgery, they will require insulin. Pre-gestational diabetes, gestational diabetes mellitus, these are the indications for insulin therapy. When you have emergencies like diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic coma, this is an indication that you have to give insulin only. Now, if you have a progressive complications like you have early nephropathy, or you have proliferative retinopathy, maculopathy, proximal myopathy, or painful neuropathy, when the patient presents with these complications, and even if the patient's blood sugar is under fair control, insulin is the best treatment to alleviate the complications. So maybe you can remove one oral agent, but you should give insulin, because these complications warrant a good blood sugar control, a tight blood sugar control, and insulin helps also to alleviate these complications. So remember, nephropathy, neuropathy, and myopathy, especially neuropathy, because of early hyperglycemia, very severe hyperglycemia, patients will come of burning pains, and a lot of night cramps. All those patients will respond to insulin therapy. Also, the early painful neuropathy will respond to the insulin therapy. Renal failure and type 1 diabetes. Renal failure, most of the drugs are contraindicated. Type 1 diabetes, of course, you have to give insulin, nothing but insulin.